Doctor and nurse practitioner Billie Huff, thanks for joining us. Appreciate your time. Our topic is your risk for Alzheimer's, the risk of Alzheimer's and contracting that disease. And so let's start with an overview. What is the difference between Alzheimer's and dementia, since you hear them used in the same sentence a lot?
Okay. Dementia is really not a specific disease. It's really a collection of symptoms. There are many different types of dementia. I explain it to families many times like we have a pie, and the pie is dementia. We slice that pie. There are several different sizes of slices, but the biggest of those slices is Alzheimer's dementia, which affects more people over the age of 65 than any of the other dementias.
Let's talk a little bit about dementia as a definition of terms. What is dementia?
It's a slowing of the cognitive process, which affects functionality, social interactions, memory. We obviously need a lot more research in dementia, not only to figure out what the causes are, but to figure out treatments as well.
Let's talk about risk factors for Alzheimer's, dementia, Alzheimer's. What are the risk factors for Alzheimer's or dementia that cannot be changed?
Age, which is the #1 risk factor.
I'm working on that, by the way.
Me too.
Not with much success, but I'm working on it.
Me too. Family history, heredity, and Down syndrome, and we can't change those things.
What about the factors you can do something about now to reduce your risk for developing Alzheimer's or dementia?
Well, there are several things that we can look at changing now that may have a huge impact later on. We need to keep our cholesterol lower.
Cholesterol and dementia, really?
Yeah.
Okay.
We need to keep our blood sugar within range. We need to address hypertension or high blood pressure if we have that. If we smoke, we need to stop.
Right.
And if we drink alcohol, we really need to be mindful of how much we drink. Some studies have shown that 2 drinks a day for a man or 1 drink a day for a woman might be cardioprotective, but after that we may see a risk in developing dementia.
Talk to me a little bit about a new study that just came out linking diabetes with a significantly increased risk of dementia.
There was a new study done in Japan. There were over 1,000 participants. They were all over the age of 60, both men and women. And what they found was people with diabetes were twice as likely to develop dementia over a 15-year period than those that did not have diabetes.
Wow. So this is pretty recent information.
Yeah, it's new. It's new.
You mentioned cholesterol just a few moments ago. Let's talk about that for just a little bit. Why would things like high cholesterol or atherosclerosis increase the risk for dementia? What's the connection?
Well, the connection is patients with high cholesterol can develop brain plaques. And, you know, when Dr. Alzheimer discovered Alzheimer's disease back in 1900, upon autopsy of his 57-year-old patient, he found plaques and tangles in the brain. So plaques and tangles have become the hallmark sign of Alzheimer's. So that's our concern with cholesterol and atherosclerosis.
Let me get you to define something for me, then we're going to talk about what it means with respect to dementia. Homocysteine blood levels, which
Homocysteine.
Homocysteine, okay, blood levels. What does that mean? And then we're going to follow that with a question.
Homocysteine is an amino acid or a building block of protein that your body manufactures, that's produced in your body. It can be measured with a simple blood test.
Right.
High levels can damage the lining of the arteries, and they can also cause some problems with the clotting system. So if you develop clots, then you increase the risk of having a stroke or a heart attack. And that, of course, can increase the risk of dementia because we've got plaque going on.
And you just answered the question. That is the connection between homocysteine blood levels and dementia is what you just set forth there. That makes sense. What effect, you mentioned this a moment ago, what effect do smoking and the use of alcohol have on the risk of developing dementia?
Smoking causes constriction of the blood vessels, which can decrease oxygen to the brain, so and blood flow to the brain. So therefore, you can develop plaques in the brain. Alcohol, of course, is another form of dementia. We do have an alcoholic dementia, but alcohol can be toxic to brain cells. It can either damage them or kill them. So that's the connection there with alcohol.
Well, let's keep drawing connections. Let's draw the connection: high blood pressure, depression, high levels of estrogen, all of which have a connection. Help us with those.
High blood pressure reduces blood flow to the brain. While it may not be a cause of dementia, it may be a contributing factor. Now, depression leads to cognitive decline and impairment. So we feel that that may be a risk factor as well for developing dementia, because researchers have found that depression can raise the risk of dementia by as much as 50%. And estrogen, it's thought that high estrogen levels can, once again, impair brain function.
Okay. And is there, because and you may not be prepared to answer this, and if you're not, I understand, but there is, concern about women as they approach menopause about, hormone replacement therapy and replacing the estrogen. Does that therapy have any, contribute any risk factor?
Well, I would probably need someone else to speak to that more directly. And of course, like everything else with dementia, research is ongoing. These links are there, and we think, and we may have a causation, we may have a risk factor, but we're still looking. Since 1900, we're still looking. And
you say we're still looking, and so that segues into our final question. Are there any promising treatments on the horizon, at hand or on the horizon, for the treatment of dementia?
Well, of course, pharmaceutical companies are continually working on new medications. Some of those medications may address inflammation factors that might be a contributing cause for dementia. There's some immunization strategies that are being looked at, some immune system modulators, and some plaque production blockers. So there's all kinds of things that are being looked at this point in time, but obviously we don't have all the answers. We continue to need more research in this area.
Well, for the answers that you have given us, we're appreciative. Thank you.
Thank you.
Take care.
Thank you.